So I'd like to talk to you today about a topic that is very timely, that there certainly has been an outbreak of swine flu, and you can only help your patients by protecting yourself and keeping yourself healthy. And even though it appears that this pandemic that's going on right now is a mild strain with very little virulence, and that the vast majority of patients seem to do fine, if you came down with the flu and were sick, you would be still home for a few days not feeling so well. So let's talk about what precautions the physician should take for that. The first is obviously to talk about protective gear that you would wear if a patient came to your office with the suspicious symptoms that they might be exposed to, have been exposed to, or have swine flu. So if a patient has a high fever combined with a cough or sneezing or muscle aches or flu-like symptoms, then they are potentially a patient who might have swine flu, especially if they have come back recently from Mexico or have been in the endemic areas of New York, California, Texas. These patients, when they come into your office, if possible, should be cohorted and asked to put on a standard surgical mask, because what it does is it blocks their sneezes and secretions so they don't spread to other people or onto the patient's hands so they touch other people or the objects in your office. But for you as a provider who has to examine these patients and perhaps get a nasopharyngeal swab from them, you need a higher level of protection, and so you need to don an N95 or N99 mask for that purpose. An N95 or an N99 mask, a specially constructed mask, this version is a duck-bill version, but there are a variety of models, that actually seal around your face and do not allow the entry of either secretions and hopefully viral particles. Hand washing is maybe the most important item in stopping the spread of flu. You may find yourself with a patient who you suspect has swine flu and who is sick and who you would like to get a sample from. The current recommendation from departments of health is to get a nasopharyngeal swab. In a patient with a respiratory symptom, they will likely either sneeze or cough at the time that you are taking the sample. When you get ready to take the sample, step to the side and insert the nasopharyngeal swab from the side. It's a very simple thought, but one that people overlook, and therefore they're standing in front of the patient, and then the patient coughs or sneezes on them.